Hello and welcome to my channel. My name is Peter Abraham. I'm a second career registered nurse focused in the areas of advanced illnesses, typically those that would either qualify for hospice or palliative care. Those are two separate types of services. I'm also a certified end-of-life doula through the International Doula Life Movement, an avid writer having published well over 500 articles, and an avid book writer, having written and published 21 books for hospice nurses, 22 for caregivers, 4 for holistic nurses, for which I consider myself one, and 6 for end-of-life doulas. If you're new to this channel, welcome. Thank you so much for taking the time to visit. In this channel, we have discussions related to death and dying. After all, we are all going to die. We're all going to die. Shouldn't we be more prepared? So I have videos for my hospice nurses. That's going to be the topic for today's video. Videos for caregivers, family members, videos for my fellow end-of-life doulas, and occasionally gardening and project updates for around the house for those that are interested. Publishing Monday, Wednesday, and Friday. If these are topics of interest to you, please consider subscribing, hitting the bell notification below. Do like the video if you do like it, because it does help small channels like mine. It's more about getting the word out than being monetized. I am not monetized at this point, and it may be years or maybe not at all. For me, I'm doing this just to try to raise awareness and to educate one of my loves. Before we get into the topic of today's video, which is going to be hospice documentation updates for those who are involved now that Hope is live, October 1st, I would like to ask you, what are you grateful for? What are you grateful for? We live in a world where lots of stuff happens around us and to us, and we are not in control more often than not. You know, we're cursed. And just these past 2 weeks, I've been helping a family remotely from several states away. They're in the U.S. Very young person who's dying, and some of the emotional hits, just trying to share with the family that's present, you know, what you're seeing is normal, what you're feeling is normal, to encourage them to share, like, this is not your fault, because sometimes family members will blame themselves as if they can change the trajectory. And it's something we all go through. We all ask this, what if I did this? What if I did that? Nothing seems to be working. And that's emotionally challenging. If you're supporting somebody, it's emotionally challenging. And I don't say that to complain. I say that from an awareness standpoint. I say that from the standpoint that if we don't work on building resilience every single day, different things that happen around us and to us can pull us down and keep us down. I believe there are 3 pillars for building resilience. I ask about one of them on this channel on a regular basis. I try to every time. What are you grateful for? So for myself, and you can keep this to yourself or put in the comments below, it's a non-judgmental channel. But for myself, I can't say this enough. I'm grateful for each and every one of you that buys and promotes my books. I just heard from a lady today. I never know what adjective to use, whether young or old, but she pointed out that she bought my Crafting Meaningful Legacies book. It's a book that has 50 plus legacy projects that you could be doing either as a death doula, a hospice social worker. Maybe your hospice hired you to do legacy work. There are hospices out there that do hire, not guaranteed. And it gives 50 different ideas using SMART goals, specific, measurable, attainable, realistic, time specific. Looking at prognosis, is you got a long prognosis, 6 months, you can do any of the projects in the book, but if you got a 2-week or less prognosis, there's less to pick from. Don't you want to finish the project on time? But anyway, before I go too far down the rabbit trail, she was just thanking me that I published the book and just sharing that she's grateful for her, or Aspen, who really promotes my Crucial End of Life Conversations book. So I'm grateful for each and every one of you. I'm grateful for my Ohio family, where the wife, I'm mispronouncing my words, sent me a very well written gratitude card, saying that she wouldn't have known how to get through this if it were not for my help. And I don't say that to lift me up. I say that because end of life doulas are necessary. End of life doulas make a wonderful difference. And while today's video is going to be for hospice nurses, I implore you, I encourage you to have an open mind for working with end of life doulas, because you cannot be in the home 24/7. Maybe you're like me. There was a nurse that I met virtually. We're on the phone a handful of times in Kentucky. And she comes across like me. She'd be the one, an hour, 2 hour visits, whatever it took, she was there. God bless her soul. Like me, she got yelled at, scolded. What do you mean you stayed past 5? Your cutoff's at 5. You should let triage handle that. And the nurse in question did the right thing. And you might be one of them, that you're doing the right thing. But even if you're like me, like this other nurse, and we're a team member of singing to the choir, we're going to do the right thing. Eventually, we do have to leave. Eventually, we have to go home, or there's other patients to go to. And it's not that like end of life doulas could live there either, but as an end of life doula, I have more freedom. I don't report to Medicare. I don't report to Medicaid. I don't report to any private insurance or any healthcare organization. There's benefits to being an unregulated body. So I could be there as long as I'm available to be there. So I do ask you to give space to the doulas that are out there. So I'm grateful for all of you. And I'm grateful for you coming and spending time. So getting into the topic for today's video, if you're not already aware, it's not going to have it in the book because this is the first book I've ever published. No, not the updated, the edition, oh my word, hand wrong place, edition 3, brand new cover. But the title, the first book I published ever. And is actually the 3rd edition. And by the way, if you're going down the route of self-publishing, Amazon, when you do KDP, it'll ask you for an edition number. Don't fill it out. Don't fill it out. The reason being is that as you publish new editions and you want to keep the same title, the same book, because you got book people reviewing and rating it. Like this is 25 stars for this book. And I think it's like 4.9 out of 5 for the customer rating. If you get that, you don't want to have to do a brand new title just because you're doing the 2nd edition or the 3rd and so on. So, but this is the edition 3. But because I put edition 1, I didn't know any better. I cannot put the edition number in my in the book itself. So normally I would put in this section of the book, I would have the edition number, and I can't. So this was just updated literally the last week of September for Hope. Now, there are going to be nurses out there, and I am not doing this video to argue or debate with them or anyone, who will state Hope doesn't impact documentation. I'd like to present a different point of view. Part of the reason why I updated it. And while their chapter 6 had it updated in terms of understanding hope replaced understanding HIS, I added a brand new chapter to the book that I'd like to bring out part of it for today's video. Chapter 7, Documenting Hope Assessment Visits. So while the assessments are fundamentally different, there are going to be documentation tweaks. I'll word it that way because I'm not trying to argue with the people who are saying that hope doesn't impact documentation. And I would argue, I shouldn't say argue, sorry, my bad. I would tweak. When you're doing the documentation, you do want to document what day in terms of HUV1, for example. So there's HUV1, the hospice update visit. So you want to document the date and that you're doing the HUV1. You do want to update the system impact assessment. That's J2051. And they want it on a scale. And in the book, on page 146, there is a documentation template for HUV1. And there's a documentation example. Let me go here. Then on the page 148, there's what if you were doing comparatives? Because this book talks about doing comparatives. Progression tracking, treatment effective documentation, eligibility, reinforcement, which is extremely critical. Part of the reason for the title of this book is you not only want to be compliant with CMS, as you are able, you always want to reinforce, why is this person still eligible for hospice? We have to remember that when anyone audits, they may not be a nurse doing the auditing. They may not have a healthcare background. And even if they are a nurse, doesn't mean that they understand hospice. The family that I mentioned I got the gratitude card, they shared with me, they're grateful for the hospice nurse, but they shared with me that that hospice nurse was brand new to hospice. They came from long-term care. They didn't know about so many things in hospice, which is 2 pointers. One, why end-of-life doulas matter, because that's why I was able to make the difference. But number 2, that could be that person reviewing the chart, and they could have the mentality of that long-term care. Oh, this is custodial. You have to paint the picture. So part of this too is symptom follow-up visit documentation. And going over what makes that difference. And then what if you can't complete it? You know, the government's great at saying, here's what to do, but what if you can't? So there's documentation that you could take if you're not able to complete the symptom follow-up visit. The example, for instance, the patient and caregiver declined. You could have SFV attempted, give the date, but the patient caregiver declined to an in-person visit. Documentation for refusal was obtained, and alternative follow-up methods were discussed. You know, there's what if the patient's unavailable, unsuccessful contact, home discharge documentation, goes into timing requirements, administrative versus clinical discharge documentation, integration with existing documentation principles, comparative charting, negative-based wording, objective measure standards. And again, there are templates that are provided. HUV1 comprehensive template, SFV focus template, HUV progression template, and then that's the end of the chapter. So I wanted to do this very quick video, but this is now out there on Amazon. I'll give a link in the description below. And by the way, let's say you have edition 1 or edition 2. Now, as an FYI, edition 2, if you, oh, I have edition 1, or I'm not sure what edition I have. Edition 2, Amazon wasn't as, I don't know how to word things sometimes, but edition 2 actually has the word edition 2 in it. They refined their technology that checks for these things, so that one got snuck in. So the only difference between edition 1 and edition 2 is I had one of my customers pointed out that in the negative wording section, there were 2 paragraphs that I had the wording was reversed. I was using positive wording versus reversed wording. That was the only change. It was very insignificant. Significant enough to say I need to fix this, but not significant enough like, oh, I'm missing out. However, whether you have 1 or 2, the document changes for this, I would say, are significant. And you might be going, and we're coming to a landing here, do I have to buy the brand new book? If you're in a financial position to do so, you'd bless me if you do. I receive a small portion as royalty. But let's say that you're like I am now from a point of view. I'm not saying that I'm poor, but like you have to watch when you pay. Like my wife was going, the other day, we got her property tax bill in, when can we pay it? And then I'm looking at the finances for when we can pay. Let's say you're in that predicament. I do sliding fees for my end-of-life doula services. What I'd like you to do if you are in that circumstance is in every book I publish, there's a way to email me. In the book, there's contact information on the copyright page. If you email me, and here's what I'm asking for, and I'm not going to send you the book, the brand new edition. I would send you a PDF file that just contains the changes. If you do one of several things, you take your pick, what works for best for you. Number 1, if you go to Amazon and put in a review for the book, if you've already have, just send me a picture of the review, the picture of the book in your lap, on whatever, and you're going to email me, so I'll have your email address, obviously. So number 1, you could do a review. Number 2, let's say you're not a review person, and I hear you. I do reviews here and there. You're not a review person. Take a picture of the book on your lap, wearing scrubs, whatever. Just show me some type of proof it's you and the book, and I'll email you the copy. But it cannot be an AI-generated image. That's my only disclaimer for that. Can't be a picture off the internet. It would have to be, and I know what those look like, but it would have to be, here's me. Like, for instance, somebody took a picture of me. Hey, look, I have the book. Or in my lap, or the review and a picture of the book and you. And just to be extremely clear, for anyone who's extremely weird on the internet, I want you to be modestly dressed. This is not anything that's sexual or whatever. It's just a matter of saying that if you want to have that PDF, I'd like to give you a way to get to it if you cannot afford to buy the brand new version. Thank you. Hopefully that wasn't too weird. Thank you. Take care. God bless.